So 2 years ago, I was diagnosed with fibroids. I don't know if it's I don't know if the right word is diagnosed because I don't think fibroids is a disease. Like, it's not a diagnosis. My gynecologist found 2 fibroids in my uterus, and now I'm getting a hysterectomy. So in 5 days, I will be getting my uterus removed. The way that the uterus is going to be removed is by a laparoscopic procedure, which means they're going to put 2 holes right here and one in my belly button, and then they're going to go in and they're going to snip, snip, snip. The hysterectomy that I'm getting is a full hysterectomy, which means they remove my uterus, my cervix, and my fallopian tubes. No, I will not go into early menopause because I still keep my ovaries, and as long as the ovaries are still going through the menstrual cycle, then I still will be having PMS and I still will be ovulating, and my ovaries will still be producing eggs, which means that I don't go into early menopause until the ovaries decide to give up on me. Now, one more thing. My doctor did say at my last checkup that there was a possibility that I had endometriosis on my right ovary. So while they're in there getting rid of all of the things, they're going to clean up any endometriosis that they do find in my right ovary. My gynecologist says that it is her duty to make sure that she protects my ovaries. So ovary removal is not going to be a thing that I have to think about right now. Early menopause is not going to be a thing that I have to think about right now. Menopause is not a thing that I have to think about right now. I'm still a spring chicken, okay? And I am actually very curious to know if there's anyone who has undergone a laparoscopic hysterectomy that is on my timeline and that would like to hit me up, because there's a few things that I want to know about what to be wary of, what I need to pack for like my little hospital bag. I've been following some TikTok pages that have talked about what to pack. I would like to know if there's anyone who would like to share their experience with me, and I'm happy to share my experience with you day by day. So today I'm going to begin packing my bag. If that's something that you want to see, let me know.
Hi everyone, my name is Dr. Sorna Saleh. I'm a gynecologist obstetrician from Mombasa. I will today talk about endometriosis, a much requested topic, and it's a whole conversation and cannot be compressed into a minute or 2 minutes. And so then I will just give you the highlights and just a hint at what it could be and what it could do, so that you may go find out more for yourself and educate yourself on it. So endometriosis is where the lining of the uterus is potentially found outside of the uterus. We're talking about the endometrial layer. So what that would mean then is every time you're having a period, you're also having a micro period elsewhere in the body. And this could be near the pelvic organs, the ovaries, behind the uterus, near the bladder, the urethra, or even in far off organs, for example, the diaphragm, the lungs, the brain, okay, and the spine as well. And so then, depending on where it's found or where it's, localized outside of the pelvis or near the pelvis, then your clinical symptoms can also stem from there. So then what causes endometriosis? We don't know, and that is just the truth of it. As practitioners, there are several theories. There is estrogen predominance, there's the genetic predisposition, there's what we call retrograde menstruation, that every time you're having a period, some of it spills backwards through the tubes into the pelvic cavity and sort of predisposes to endometriosis. It is neither here nor there, but most of the time we actually think it's just a genetic predisposition. How does it manifest? Very painful periods, very heavy periods, very irregular periods, very painful sex, coughing, and spitting out blood every time you're in your period, depending on where it is. I once had a patient who had brain endometriosis. Every time, not a patient, I was a student then, so I saw a patient. So every time you're having a period, you're also having convulsions, because there's something taking up space and causing an inflammatory process in your brain. So it could be anything. It could be absolutely anything. So I usually say as long as a symptom is tied to your period, there's a cyclical nature to it, you should have a high index of suspicion for endometriosis. So then what do you do if you have endometriosis? I would say seek care immediately, and the treatment methods here could span from as medical management to surgical management to lifestyle modification. But I would like to clarify here that the making diagnosis or the diagnosis of endometriosis here is key, and laparoscopy is usually the gold standard towards diagnosis of endometriosis. A scan can also suffice. CT, MRI can also do, but usually we insist that sometimes hysterectomy, laparoscopy could be what could, make a definite diagnosis. It is also important to note that even as a diagnosis is being made through laparoscopy, that the same instance can be used to actually cure. It is also important to add that there are endometriosis licensed surgeons, and not just every gynecologist is licensed to operate on endometriosis patients. I am not one of them, but in this Kenya of ours, thankfully, we have several. So take it upon yourself to educate yourself and to seek them out so that you can get the best care possible. When we're talking about endometriosis, the highlight here should be on the quality of life. So quality of life here being restoration of a normal anatomy, prevention of fertility and the effects, prevention of fertility, infertility as a result of endometriosis, the effects of endometriosis and the general quality of life. So we might not give 100% cure, although that is the goal. But even though you do not get 100% cure, that we do have as much restoration of your quality of life as possible. I hope this sort of brushes through, tickles your interest to go and dig more. And if at all there are any questions, kindly, you can drop them down here and we'll answer them for you. I hope you have a blessed day. Namaste.
One thing about having a difficult stomach, you also suffer, Risha. You're going to suffer. I still suffer from constipation. I didn't know. I thought I was over it. Like I thought it was over. And man, the worst thing is I went to the toilet because I felt the urge to push, like in long busy, trying to push out something because like you know. I don't know, from that pushing, maybe stitches from my operation, the last one opened. I don't know, but I just started, the pain shifted from my lower back to my front. It's like my whole pelvic area is being sliced into two, like it's being cracked open. Oh, guys. The one thing I think that's getting me even more emotional about this pain is the fact that it started off when I was helping my son with homework, and I kept trying to ignore it so much that I couldn't. My son was so worried. He was in panic mode. Like he kept saying, "Ma, what's wrong?" I'm like, "No, I'm gonna be fine. I'm okay. Let's just continue." But you could tell he was so worried. So then we did the homework very fast and he left. That for me is the one thing that sucks about being very far from your family and having to be a parent while you are sick. That is the one thing that really broke my heart, Shem. But you know what? This is exactly what I've tried to not show. It's a side of me that I've tried to not show to my son throughout my chemo. And now he sees it today. Me, like, crying in pain. And at that time, I wasn't really like emotional. I wasn't crying or anything. At that time, I was just still making sounds, of pain. And now, aibo, guys. So from then, I drank pills. I'm a painkillers. Are they helping? Dololo. Dololo. They are not helping. I am just rolling up and down, like literally. It feels like, it feels like a baby is pushing and it wants to come out. That's how painful it feels. But now, I'm just feeling so bad because I'm thinking, what if the stitches from my last operations are the ones that opened, maybe, or something happened, because the pain just shifted from the back to the front very quick after pushing. And God save me, guys. Yes. Have you ever been in so much pain uzufike la uthi ayifoka akwenzeke okwenzakalayo ngeke? I'm tired. Why? Cabanga ngisho ukuzi-admit literally, like I just feel like it ukuthi I can't take it anymore. Like what? But anyways, I hope it get better. Oh my. Ooh. Let me just go by, guys.